As the level of integration of technology into everyday life rises, the threat of human error in affecting many processes is reduced. However, the prescription issuing and dispensing process is still very much at risk. By introducing automated prescribing systems, it will help reduce the risk of adverse effects and medical errors that come as a result of these prescription errors. The root causes of these prescription errors arise in such instances including, but not limited to, illegible handwriting of doctors, fatigue, and whether the patient was the doctor's own. The results of this branch out and have damaging adverse effects. The consumption of incorrect dosage or medication may result in ineffectual treatment, thus coming at a cost to both the consumer and the healthcare system, as the patient must then acquire the correct treatment. Furthermore, incorrect dosage or medication in more serious cases may result in side effect or, in the worst cases, death. 65% of the United States takes prescription drugs, and in 2005 they spent $250 billion on drug prescriptions. These prescription errors account for 70% of medication errors that could result in adverse effects. Furthermore, it is estimated that there are 100,000 prescription drug-related deaths in the US per year. There is a sustained increase in reported deaths in serious conditions from 2006 through to 2014, as shown in this graph. If prescription errors throughout the world can be reduced, the UN sustainable goal of good health can be significantly improved. To reduce prescription errors, our solution is a cloud-based database of all patients. Each patient is set up with a personal account and accompanying ID card, through which doctors are able to view the patient's medical history, medication, and dosages. The system also tracks medication prescribed and will not allow simultaneous prescriptions of conflicting drugs that could have adverse effects. To issue prescriptions, doctors simply log in online, and by selecting the current prescriptions folder, they can prescribe any medication, dosage, and repeats they wish. Pharmacies are also able to access the online system to view and process current prescriptions, however will not be authorized to view any further medical records of patients. The simplicity of tracking patients' history and issuing prescriptions will likely lead to the reduction in prescription of incorrect medication and dosages due to fatigue and unfamiliarity with patients, as few actions by doctors are needed, and they have full access to all relevant information as well. Furthermore, the reduction in use of paper for physical prescriptions, as well as the actions needed to rectify errors, will reduce the annual cost. Finally, this system will eliminate any discrepancies in the interpretation of doctors' handwriting, resulting in accurate dispensing by pharmacies every time. Our value category is to reduce costs, and our key performance indicator to measure this is to measure against the annual cost of prescriptions and calculate the reduction in total annual cost